Welcome back to MTP number 70. I hope you enjoyed 69. We definitely did, for sure. Today, we're going to have a sort of a hybrid conversation with you. We've talked a lot about Peyronie's disease, a little bit about our other endeavor, which is UroFill, which is the only patented technique for girth enhancement. They kind of go together in many ways. Clearly, Peyronie's is a devastating disease. Many times guys don't even recognize their penis by the time they get to us. I'm sure you see a lot of this on television because there's a lot of commercials for a drug that's out right now that has questionable efficacy for Peyronie's disease. The way I like to look at my Peyronie's patients is based on a conversation that I saw at a meeting in front of like 300 people between one of my mentors who was on the podium, and he was talking about Peyronie's disease. And he said, I'm going to use his accent. He said, hey, if a guy's over 50 and he's got Peyronie's disease, he gets a penile implant. And one of my other colleagues, he rushed up to the mic because he did a lot of work on guys that were potent to try and straighten their penis and take care of the irregularities. And he says, oh, I think you're cavalier and hubris, for doing this. But he's right. He's right. It's such a devastating disease that you need to attack early. And yes, I still go by that dictum that if a guy's over 50 and he's got Peyronie's disease, I'm really starting to look at a penile implant. Now, I've found that for the most part, we can get rid of most of the defects that have occurred, meaning these hourglass, these notches, these curvatures at the time that we put in the implant. But then there are some cosmetic issues that can be addressed using the patented UroFill technique. And this is where we're able to fill in these areas and sculpt the penis with this hyaluronic acid technique that we use to make the penis symmetric and something that you recognize. So I want, for those of you that have Peyronie's, to understand that, yes, we can, if you're potent and you have a defect and that disease has arrested, yeah, we could fill in these defects. Yes, you need to keep in the back of your head that if this disease continues to progress, that you might be looking at a penile implant. But between the two, I think we can cover most of you so that you recognize your penis. So guys, if you want to recognize your penis, think about those two things. Have a good one, and we'll see you for 71.